Hello everyone, welcome to my channel. Register as nurse, your go-to destination for all things related to nursing in Canada. Today video is on a pharmacology and NCLEX pharmacology. We all know that and pharmacology is always hot topic on NCLEX exam, and most of our students struggle on that topic. So I made a presentation on anti-anxiety drug, and this presentation is basically based on my notes that I took when I was preparing for my NCLEX exam. So I hope this presentation and these notes will help you to understand what is anti-anxiety drug, how they act, and what are the what key notes that we remember when we are going for my NCLEX exam. Okay, so let's start this video. So anti-anxiety drug is also known as anxiolytic drugs. So as the name indicates, a word anti means against, right? So these are the drugs that are used to manage the symptom of anxiety. All right. So it basically reduces the anxiety, and it also provides relief from physical symptoms that are associated with anxiety, such as tachycardia, sweating, muscle tension. Okay. So basically, we have two types of anti-anxiety drugs. One is the benzodiazepine, and the second one is the non-benzodiazepine. So we're going to study about benzodiazepine and non-benzodiazepine one by one. So let's first focus on benzodiazepine. Okay, so benzodiazepine, these drugs basically they enhances the effect of one of our neurotransmitter, that's a GABA, also known as the gamma aminobutyric acid. So benzodiazepine basically enhances the effect of GABA. So what happens when GABA neurotransmitter increases in our body? So when it increases, it basically produces the calming effect. So that's why we used it as an anti-anxiety drug, because it calm down our body. Okay, so that's the action mode of the action of the benzodiazepine. Now, there are some facts that you have to know and remember when you are preparing for your NCLEX exam, right? Because NCLEX exam study on your knowledge are related to the patient safety, okay? So these facts are related to your patient safety. So do remember them. First one is benzodiazepine induce sedative effects, okay? It resolve the anxiety symptom, but it also induce the sedation. And benzodiazepine make your body go low and slow. That's the key point here, low and slow. Okay, these drugs act so fast, so you're gonna see their effect within minutes. But there is a one negative point here. There are the high probability of addiction. Okay, so when your patient is on benzodiazepine, you have to educate them about dependency on these drugs, and you have to monitor to avoid the dependency. Okay, all right. So here is a trick to remember name of benzodiazepine. Okay, so if you see drug on your NCLEX exam that end with LAM or PAM, that there is a high probability that's a benzodiazepine anti-anxiety drug. Okay, so some of the example of the drugs are alprazolam, midazolam, both end with LAM. Others are the clonazepam, diazepam, lorazepam. These drugs end with PAM. So remember, LAM and PAM is a benzodiazepines. Okay. Okay, so next is what are the indication of benzodiazepine? When we use these drugs, right? So these are used for the acute anxiety or panic attack. These are used as a short-term treatment of severe anxiety. Okay, so benzodiazepine are always used as a short-term treatment. Why? Because of its high probability of addiction, right? Since it also has a sedative effect, so sometimes we use it for sleeping disorders as well. Other than that, we use them as a muscle relaxant, because it make your body go low and slow, right? So it make a muscle tone go low and slow. So we use them as a muscle relaxant to treat the muscle spasms. Preoperative anesthesia. So because of their sedative effect, we use them as preoperative anesthesia. Patient on ventilator. Patient on ventilator, you know that they have the anxiety, right? So to treat that, we use the benzodiazepine. Alcohol withdrawal. We all know that alcohol withdrawal is associated with hyperexcitability of your body, right? So to reduce that hyperexcitability, to treat that, we use benzodiazepine. Why? Because it makes your body go low and slow. Seizures, right? We use it against seizures as well. Again, low and slow, right? All right. So next is a side effect. So we know benzodiazepine make a body low and slow. So what will be the side effect, right? So it will make your blood pressure go low. It will make your heart rate go low. It will make your respiratory rate go low, even to the point of respiratory depression as well, and sedation. So these are the huge side effect of benzodiazepines. So you have to educate your patient and you have to monitor your patient about these side effects, okay? Patient teaching. So what teaching you are going to tell, or what are you going to tell your patient when they are on benzodiazepine, okay? First of all, take at a bedtime. Why? Because sedation, right? It induces sedation, so it's always a good to take at a bedtime, okay? Teach your patient that they are not allowed to drive and operate heavy machine after taking these drugs because of sedation, right? If they took their drug, sedation gonna induce, and if they are driving and they are operating the heavy machine, that cannot be a deadly, right? So teach them, do not drive and operate heavy machine after taking these drugs. Do not miss your dose. Even if you feel okay, continue your medication and never ever stop these medication abruptly, okay? You have to consult your doctor always, because these medication need to be tapered off slowly. So we never stop this medication abruptly. We have to consult doctor and we have to go slowly when we are tapering off this medication. And do not drink alcohol and wine when you are on benzodiazepine. All right. Another nursing consideration are monitor for the liver and kidney function test when your patient is on the benzodiazepine. And if there is an overdose of benzodiazepine, good thing is that we have its antidote, and the antidote is flumazenil, okay? Note it, flumazenil. NCLEX always test on antidote. So you have to remember antidote of the benzodiazepine is flumazenil, okay? Okay, this is all about the benzodiazepine. Now we are jumping to the another type of the anti-anxiety drug, which is non-benzodiazepine, okay? So most common non-benzodiazepine is buspirone. And now we're going to compare it with the benzodiazepine, okay? So benzodiazepine induces sedation. Non-benzodiazepine are not sedative. They are non-sedative, okay? Benzodiazepine, there is a high risk of dependency, but of non-benzodiazepine, there is very low risk of dependency, okay? Benzodiazepine act on GABA receptor, while the non-benzodiazepine buspirone, it act on serotonin receptor, okay? So it basically increases the activity of the serotonin neurotransmitter in our body, okay, in our brain. And what's the effect of that? Again, it induces the calmness. So both benzodiazepine and non-benzodiazepine induce calmness in your body, but the more how they do that, that's a different. Benzodiazepine do by enhancing the GABA receptor. Non-benzodiazepine you do that by increases the activity of serotonin receptors, okay? All right, indication. Chronic anxiety. Benzodiazepine, we use them for a short-term treatment of anxiety, right? Why? Because of high dependency, right? But these drugs, non-benzodiazepine, we can use them for a chronic anxiety. We can use them for a generalized anxiety disorders. Side effect, to remember the side effect of non-benzodiazepine, here is a mnemonic, DHL. D stand for dizziness, H for headache, L for the lightheadedness. Okay, why dizziness and lightheadedness? Because it actually, when serotonin receptor increases, the vascular activity increases, vascular tone increases. Okay, so that increase in vascular tone lead to dizziness and lightheadedness. Why it causes the nausea? Nausea because 90% of our serotonin receptors are in our GI tract, right? So when their activity increases, it increases the motility and sensitivity of GI tract. And that increase in motility and sensitivity leads to the nausea and headache because of increase in the neural activities and increase in the vascular tone lead to the headache. So these are the most common side effect of non-benzodiazepine. All right, nursing considerations. So you have to teach your patient that these non-benzodiazepine gonna take a 2 to 4 weeks to show their effect. So if your patient come after 1 week and tell you, okay, these drugs are not working, okay, so you have to teach them before that they have to give the 2 to 4 week, and after 2 to 4 week they're gonna see the effect of these drugs. So it basically take a time to show the effect. So that's why it's not used for the immediate relief of the anxiety. For immediate relief of the anxiety, we use the benzodiazepine. Okay. Other thing is that this is the non-sedative. So this is always a good option for patient who need to stay awake after taking those drugs. Okay. So 2 to 4 weeks and it's a non-sedation. All right. So that's all about the anti-anxiety drug. It's type benzodiazepine and non-benzodiazepine. Thanks for watching this video. Please do like and subscribe my channel. And if you have any suggestion or if you like my my video, please let me know. Thank you for watching my video. Bye.